All right. Hi, good evening, everyone. I'm not going to take up too much of your time this evening. There's already been so many amazing resources shared, and I feel really grateful to be here. And a thank you for taking the time to be here and to take time out of your Thursday evening to talk about something like this. It might feel small, or it might have felt like a large decision after a long day of work, but either way, choosing to engage in conversations and to have education like this is truly meaningful. And so today I want to talk to you all a little bit from three different perspectives, but one of them I think is the most important for this evening. I work, as Octavia mentioned, I work for the Virginia Department of Behavioral Health. I work as the Adverse Childhood Experiences Coordinator. So a large part of my role is in working on how does what we experience in our childhood affect our day-to-day lives. I also am a senior in college here, getting my bachelor's in psychology and hopefully one day continuing a career in clinical psychology at William and Mary. But the most important lens I think that I want to speak to you all about today is just Marrin, who recently and graduated in, I guess, 2018, Marrin of Patrick Henry High School. And the Marrin that was raised in Hanover County has roots here, has through and through gone to Liberty Middle School, and a PH graduate, and still always will be a Hanover County member, and someone that has personal experience with youth depression, with suicidal thoughts at a young age. And I want to come back to that and talk about that from this lens of now in my position and what I wish that I could have been told and what I would like to share with a bit of my story. And so going off of that, right now in my role with the state, a lot of what I do is talking about these high risk factors, these risk signs, children, students, youth who face acute challenges and adversities in their lives, whether that is from an economic standpoint, an abuse standpoint, a toxic household, and these very blatant risk factors and signs for later mental health issues, whether that is depression, substance use, or suicidal thoughts. And all of those stories are extremely valid. All that was just mentioned of risk factors, risk signs, that's all extremely valid, and those stories have space. But that isn't my story, and it's not the one that I'm going to share about myself and about really what feels not like myself anymore. I always try and make space and do this 13-year-old and 14-year-old girl proud who hit this point, because she went through a lot of things. And though it was a long time ago, and in a lot of ways it feels like I'm trying to recite and reiterate someone else's experience, it was my experience. And in that, I grew up in just the most like fiercely loved household, and no one would have imagined or thought that I had hit a very quick onset depression when I did at 13 and 14 years old. A lot of my after that period was ask the question of why, or that was an original thought that comes up, and that's natural to say, why do you feel this way? But I didn't know. I maybe it was brain chemistry, maybe it was a combination of environmental factors, but really the why isn't what I want to, or the how I got there isn't the important part and what I want to talk to you about right now. What I want to talk most about is who and how they got me out of that, and how grateful I am. And so this middle picture was when I was 13 years old. I was at my eighth grade, I guess that's your like eighth grade Liberty Middle School dance. And that was when I had first started having some serious thoughts of depression. I very quickly from a surface, I was great. I was in sports. I had a consistent group of friends. I had good grades. I was very active, and I had a high support system, a high friend system. And suddenly all of those things had fallen away somehow in ways that I couldn't understand, my family and friends couldn't understand. But very quickly, my appearance changed. I was withdrawn. I had a completely different circle of friends. I was not doing as well in school. I had dropped out of sports. I was instantly at once, I didn't recognize my own thoughts. And in that, I didn't recognize myself, and neither did the people around me. And so I'm extremely lucky that part of my story was that my parents, they chose to see that, and they chose to take that extremely seriously. And that when it seemed like something was wrong, they acted on that immediately. They chose to step into that place with me, to get me help, to check in on me. And we, as a family, we were uprooted and we were untethered. We had no idea that we would be a family that was experiencing this so quickly. We would have never imagined that was something that we would go through, but we went through it together. And the fact that we did go through it as a unit is exactly why I was able to get help via a therapist, via medical attention and support systems. They listened to the advice of professionals. They locked legal means. They checked in on me. I was able to get support from school staff members to get exemptions on certain types of schoolwork. My one job, and the way that I was supported, was my job was to get better. And I'm so lucky that I was given that space. And that space is what I'm asking you all and what I push to give to students today. And that was, to the right is my graduation photo. And once I hit 18, and that felt like such a long chapter ago, it really wasn't. It was in that space that I learned that I wanted to pursue psychology. I wanted to understand, how do we build communities that are not scared of having these conversations? And in that, I began not afraid to have this conversation and to speak about what I had felt and gone through, because in that, I understood that that's how we strengthen communities. It's how we strengthen people. That is a conversation of resilience, and growing that together is having these conversations, being vulnerable. And that really opened my eyes to the power that can come in that. And so when I talk about this concept of being untethered together, that is what my support system and I were. And really, this is all a long-standing thank you and nod and just gift and a grace to my parents and to my family who stepped into fear. Because when you're faced with a child who is having really serious thoughts of depression or of suicide, there's nothing scarier than that. There's nothing more frightening than having those conversations. But that is what I hope, and that is what I ask of parents, of community members, is step into that fear, because the child that is having those thoughts, they're scared too. So be scared with them. Just because you are the parent or the one in charge, it doesn't mean that you can't be afraid. You're allowed to be, but just be with them. And oftentimes our fear can keep us from having conversations. We feel like if we don't have the answer to a problem, if I ask my kid, are you doing okay? And they say no, and I don't know what to do after that I don't want to touch that. So I'm just not going to ask. If we have that mentality, we're not going to have some of these potentially life-saving, vulnerable moments with our kids. And we do not have to have all these answers before we support children, students struggling with depression or with suicidal thoughts. And we'll never have all of those answers, but the ones that you do have are, I love you, I'm here for you, I'm going to listen to you, and there are resources out there. Let's talk to somebody, let's get you some help. It's okay to say, I'm scared, I don't know what's going on, but I know that we can do it together. And accepting that fact is huge in opening real conversations with kids about depression and mental health. And so it's just this pledge as a parent, as a community member, as anyone that wants to support someone you think may be dealing with suicide or depression, that I am willing every day to be afraid with you, and that's okay. And it's going to be a day by day process, but we're going to do it together. And so in that, the most important thing is to talk about it. There's a common sort of misconception in the space of mental health and in schools that talking about suicide, that's a fear of, well, if I bring these things up, is it going to make it more real? What if my child was just sort of asking for attention? What if it's a phase? If I bring up something, what if I give them an idea? But over and over again in literature and research, we are shown that this is not true. This just isn't the case. And I will be honest, I mean, I experienced depression and suicidal thoughts 8-9 years ago. Social media looks extremely different right now than it did back then, even now. And so any concept, anything that triggers that fear of wanting to make sure that we're not having too vulnerable of conversations with our kids, it's more than likely that they have seen and have been exposed to social media in ways that we would have never thought 10, 20 years ago, the type of content that's being made. And that's not coming from a fear mongering or a scaring place. That's coming from find strength in the fact that our children and students are itching to have these conversations. Find strength in the fact that you're going to add your voice to that of saying, have you heard about this? How are you feeling? What are people talking about in school? Just so you know, and then insert your support, insert your resources. The truth of talking about these things, even in my experience, when I was in some ways uncomfortably approached, uncomfortable because I didn't know if I was ready to receive help, but still the moments that, regardless that I was approached, that I was checked in on, even though I was withdrawn, the constant, yes, I'm fine, get out of my room. My parents still showed up. They fought against me sometimes, but were always fighting for me. And it was in those moments that I felt more understood. There was more empathy. We were vulnerable. There was a far bigger opening to really understand that I needed professional help and to get solutions. And a really important part of dealing with someone that has depression or a child that is experiencing suicidal thoughts, or in just being a support system, if it ever comes to that fact where you are in that situation, which hopefully in some point you will be equipped if that happens. But just know that the child is never alone. The person experiencing that is never alone, but neither are you. It's a really big ask to support a teen, a child that is experiencing a mental health problem. I know that my parents have told me that, that was some of the loneliest times in their life. Was, you can't think of a bigger judgment on yourself, a bigger isolating factor than having a child in your home who is saying that they don't want to be here. But that couldn't be further from the truth of the fact that there is no judgment, and that judgment is self-imposed, and removing that stigma, not only for the child, but for yourself, equipping yourself to have power in your ability to support and to change. There are support systems for parents who are trying to seek these conversations, those conversation cues that were mentioned. There will be resources provided after this presentation. You can seek a referral from a mental health professional if you don't have access, or that's something that your family hasn't approached before. Primary care physicians are great places to start. Pediatricians, great places to start. Also, your schools. There's so much that exists within school counseling centers, within your guidance counselors, that you can approach as a unit, as parents, and as a family, and reach out to your community, challenge your community, and just start having these meaningful conversations, these vulnerable conversations. And that's a part of destigmatizing that will come so quickly if we can start to speak with each other about not being afraid of the words depression or of suicide until it's too late, and until we're talking about them within a tragic context, but talking about the moments that the support has helped us, moments that we have felt low and lost, and how we came up from that. Those conversations are so important to have. And so if really I could say anything, I was thinking, what do I want to talk about? What do I wish that I had heard, or anything on that nature? That's ultimately the most important thing, is just to accept and to love and stay supported with one another. And I wish that I could, a million times over. It's a large thank you to the people who they stayed untethered with me. They were unanchored, they were afraid, but they chose to fight through that, and they had resilience themselves in the ways that they supported me as parents and supporters, community members, my teachers. And in that, I built my resilience. I had a support system that was able to get me back to a safe and a healthy place, and gave me that space to get help. And that is what I'm so grateful for. And in that, through days of vulnerable conversations we never thought we would have, we grew closer as a family unit than we have ever been before. We became a family that did not have chats about mental health, to families that now have almost daily mental health check-ins. And I wouldn't have it any other way, because that is just like our physical health. It is a part of living, and it can be a really beautiful thing and a beautiful instrument to share. And so please reach out if you have questions about asking questions. Reach out to your children, asking them open-ended, not coming from a place of self-evaluation that you have to be prepared for an answer, prepared to fix. Just reach out, just hear from them. How most likely, if you come from a place and approach from a place of being truly curious about the experience of teenagers and children right now, I think you would be surprised by the authenticity that would bring. Find resources. There are so many out there, wonderful resources. Lock and Talk is a great resource, and those will all be provided. And then ask for help. If you don't feel like you have those answers, that's okay. Don't let that stop you from asking the questions that you need to be asking. And again, that's my contact information. I'm more than happy to speak with anyone, and this will be provided as well. And thank you all for your time.